There we go. All righty, hello. So I'm really thrilled today to be talking to Debbie Gadd, who runs Manula massage and therapy, and she's been a fantastic therapist for me over many years. She's got magic fingers. She really does. She's quite an extraordinary woman. And she's also an amazing scar therapy person. And today I wanted to invite her along to talk more about the scar release therapy. So Debbie, hello and welcome.
Hi, Linda. Hi. I'm so glad I've got magic fingers.
You've got magic fingers.
What can I say? I'm talented.
Well, we must use our talents, mustn't we? So
yeah, we must. Yeah.
Yeah. So I just wanted to ask you to explain what what scar work actually is for those who don't know.
Yeah. Okay. So scar work, a lot of people, when they have surgery or injury or whatever, well, they're left with a scar. But for a lot of people, the scar causes problems. So the formation of a scar and the healing of a wound is really complicated. And it just shows how amazing our bodies actually are. Have a look at the whole cascade of events that happen. First of all, the wound puts in a plug, a temporary plug to stop bleeding. Then you get an inflammation stage where all sorts of things are going on. Your immune system kicks in, it cleans up all sorts of bugs and things, the dirt that's got in. Then we go on to the proliferation stage where cells are being built. So you're building that bridge between the two sides of the wound. Really complicated, but magic stuff. And then you get the laying down of the collagen, which is basically the tissue that holds everything together.
Okay.
That you then get what we call the maturation stage, which will last up to 2 years. It can last longer, but that is as the scar matures. There's breaking down and rebuilding and breaking down and rebuilding to build up that tissue. Unfortunately, with scar tissue, it never reaches the same strength as your original tissue. Your scar is only going to reach a strength of about 70% of that. So that is why, often with surgeries with cesarean sections, with women who've had 2 or 3 cesarean sections, that scar is really weak because the tissue cannot heal as strong as it was before. Okay.
So hence after somebody's had, say, 3 cesareans, they're advised not to have any more children. Because
very much so. Yeah.
Potential rupture. Okay.
Yeah. But now with that whole, with the whole cascade of how things occur and in which order, and sometimes things go a little bit wrong. So if your inflammation stage lasts a longer time than it should, you'll often end up with a scar that remains red. So you talk to people about redness in their scar and they say, yeah, it's been red for ages. That just means that the inflammation still hasn't died down. You'll get that with adhesions. So in the proliferation stage where more cells are being laid down, the healing is happening, you're building the scar. Sometimes what happens is that those cells in the collagen actually attach themselves to other tissues in the surrounding area.
So is that the adhesions? Is that what you call?
Those are the adhesions, yeah. So
that's the collagen sticking, is it, to
yes.
this?
If you've got your cut and it's now healing nicely, you'll have all this stuff that's going on underneath, and those cells can often adhere onto the internal organs.
Yes, okay.
So you'll have women who've had hysterectomies or cesareans who will talk about pain during intercourse. They'll talk about incontinence.
Yes.
Tissue can attach to the bladder, it can attach to the bowel, it can cause all kinds of problems,
So hang on a minute, can I just ask you, say you had a hysterectomy because of endometriosis.
Yes.
Yeah, and now you're suffering with incontinence issues. Could it be not actually that there's more endometrial or endometrial tissue externally? Could it actually be that the hysterectomy has caused scar tissue or scar adhesions?
It could be, but if you have a look at endometriosis itself can cause adhesions and scarring because it is an inflammatory condition itself.
Okay, right.
Just by having endometriosis, and all of that inflammation, you can have scar tissue forming without having surgery or an injury.
Wow, I didn't know that.
Yeah. So I'm doing a course at the moment, an online course with Emma Holly, through whom I first trained. It's all about understanding scars, and it's really opened up my eyes to what really happens in healing and how it can affect you. And a lot of people will say, oh no, my scar's fine, it doesn't hurt at all. But then when you have a look at how they're standing, they're leaning over slightly to one side, because all of the fascia, which was cut during the surgery, has now pulled, and your body's made adaptations to deal with that. And now you're walking upside. Yeah. And people will say, no, it's fine. But your body makes all of these adjustments subconsciously. You don't actually know your body's doing it. Your body's just saying, whoa, something's happened here. We need to adjust, and I'll change here and I'll change there. And you're just carrying along like normal.
So hang on a minute. Let's just, because that's really important to talk about, I think, the fascial, like the fascial system underneath the skin surface. Because not many people still know about that. And so would you mind, just before we jump on to what you do as far as release work, can you just talk a little bit about the fascial system?
Okay, so the fascia is mind-bogglingly amazing.
It's amazing, isn't it? It's amazing.
Oh my word, I'm getting goosebumps already just thinking about it. It is, it's so exciting because it's everywhere. It is absolutely everywhere in your body. It basically is there around all the cells and the muscles and the organs and the blood vessels. It's everywhere. And with fascia, it can often have blood vessels and nerves running through it. So if it really tightens up in one area, that's why you will often get a reduction in healing, especially with that, because they're not getting the blood flow. And you'll also get pain. You'll get that constant pain because those nerves are being squashed by the fascia. So fascia is all the way around your body. It is everywhere. If you think of the foam on a cappuccino, your bubbles, okay? That's basically what your fascia is like. Every little bit is joined to every little bit. And if you push the bubbles on the one side of the foam, you'll see it kind of shifts all the bubbles across your cup.
Oh, I like that example. Yeah.
So now if you take a spoon and you cut in the middle of the bubbles, when you push on the one side of the bubbles, you'll see that the other side doesn't respond anymore. Because that whole bridge and that linkage between the different areas of your body has now been cut. You think about you with yoga. If you were to cover yourself in a stretchy like net, moving one way, the fascia is adapting, it's doing it, and then you move another way, the fascia adapts and it changes everything. Now cut that net that you're wearing. And you can't lift your arm quite so high because there's no give and take. Or because you can't lift your arm so high, your leg doesn't want to move quite so well. Or you've got pulling in your stomach, which pulls your chest down. What is the fascination about fascia?
I love doing that in yoga classes. I say it's like I said, a big body glove. And when we're doing full body lengthening, right from one fingertip, right through the body, right out through the other toes. So we're lengthening, we're stretching, hydrating, and then bringing it back and then lengthening, almost like a crepe bandage. That kind of thing. Yeah.
So now you imagine cutting that across the body.
Takes away the stretch.
It takes away the stretch, which means that your yoga pose and the fascia, the net, is going to have to change how it works.
Yes, you're right. Because if it was say we just looked at a crepe bandage and was stretched, and obviously that's just one way. If we and then you cut the edge, then obviously the other side is going to be where all the work
stretch goes. And on the other side you've got that big gape that opens up and closes. But what is that fascia now?
And then it's all weak then, because it's not getting lengthened, it's all weakened, isn't it?
Fascia, it's just amazing. So even we're doing keyhole surgery, it's very small, it's minimally invasive.
It's not
it's hugely invasive, because they'll stick 5 holes in you, they'll blow you up with gas, so that's the one thing that's been shoved into you, and then they shove a light in, and then they're shoving, and all underneath the skin, around wherever they're working, all of that fascia is being broken. And it then have to heal, and it will have scars in it, which means it can't work the way that it used to, which means your organs can't work the way that they used to. They will be changed in their shape or how they squashed or whatever. And I found with a lot of people who've had mastectomies or abdominal surgery, when you've done a little bit of scar work on them, when they stand up afterwards, they suddenly go, oh my word, I'm standing up taller and I can breathe.
Yes, you can breathe. Yes,
because it pulls the diaphragm in.
Yeah.
Thing in. In fact, I have a woman, I'm working on her with she had a Dieppe reconstruction of her breast. So she's got this huge scar all the way across her tummy. And she had lymph nodes removed from under her right armpit. And she said to me when I first went, she said, I want you to work the Dieppe scar. She said, but just have a feel at this lymph node scar up here and around the edge of the breast where the reconstruction was done. And it was quite hard and felt stringy. And she said, I don't really want you to work on this, but do you think you could? I said, yeah, that shouldn't be a problem, but let's do the Dieppe scar. I've worked on her Dieppe scar, I think 4 times now. And when I went to see her last week, she said to me, just feel the scar under my arm. Does it feel different to you? I couldn't believe it. That scar is softened.
Interesting. Because it's not being pulled as much inappropriate.
Because the Dieppe scar has softened quite a lot. And we don't only work the scar, we work all the surrounding tissue. So for a Dieppe scar or cesarean or whatever, we may even work in the top of your legs. We'll work right up into your ribs, under your ribs, round your sides, everywhere. Because when they're doing surgery, they're sticking swabs in, they've pulled you open. The edges of that tissue, depending on how long you're in surgery, the edges of the tissue will dry out, which means when they sew you back together, there's no moisture in there. They clamp that, so it reduces the blood flow into the edges of the tissue. So there's huge damage done. They're putting in swabs to stop bleeding, and they're cauterizing, and they're doing their thing.
Isn't that, yeah. Do you know, Debbie, what you're talking about is so relevant to the class that I just taught today. Was number 2 in the pelvic floor restore course that I'm doing. And today was all about that reconnect, sort of the down training, the release work. And I was explaining how tension patterns within the fascial system in the pelvic bowl, tension patterns are underneath so much of our pelvic floor dysfunction because of exactly that kind of pulling, that condensed, I'm describing it like a very thick spider web. When you see a very, very thick spider web as opposed to one that's a bit more open and everything being pulled towards you. If you've got scar tissue from an episiotomy or from 3rd or 4th degree tearing, then the fascial system and the scar tissue can literally be pulling those organs out of place. And we can have pain. We can have pain with intercourse. We can have urgency issues because of that tension. So what we were doing was starting to try to reconnect and breathe into and slowly start to give a little bit of space into a very precious area.
People don't understand the huge impact scars have. And when I say to people, I can work your scar, I can make some changes to it. Oh no, my doctor said nothing can be done. And I said, no, but something can be done. Oh no, my surgeon says nothing can be done. And you get that look like, well, you're just a little massage therapist. What do you know?
You know, Debbie, I think that's also, because I was just doing a one-to-one after the class with a psychotherapist, and we were saying how, isn't it, really, we live in the society still, it is changing, but we do where everything, the emphasis is on go, do, do. If you've got an hour, you go running. It's all about productivity and going. No gain. That kind of mentality that we grew up in. Now we know intellectually that's not the right way to go. We are programmed. So when we are talking about release and calming and lengthening, for many of us it goes, oh, it's a bit boring. It's a bit like there's no doing there. There's no action. So it almost feels like, am I being lazy doing that? And it really is bringing in the yin to the yang. We've been so yang dominated for all of our lives and many centuries beforehand. And now bringing back that yin, that state of opening, accepting,
yes,
lengthening, nurturing, calming, which is that massage, that releasing
yes,
away from the tightness to the openness.
yes,
It's a mental process, isn't it, as
yes,
well as a
yeah.
physical process.
But I just want to tell people, scars, the earlier you start working on a scar, the better, because of the healing that is going on and making sure that you get the collagen and everything in the right place and lined up the way that it should be.
So when would you, so somebody has had a mastectomy, for example,
yeah.
When after their surgery would you want to start working on that scar tissue?
Okay. For us as scar work therapists, we would normally start about 8 to 10 weeks after surgery, unless we've had to contact the surgeon to find out if there are any reasons. Okay, so specifically abdominal surgery, if mesh has been used, I am not allowed to work mesh.
Sure.
Okay, can work mesh if it's in the breast, but not in the abdomen. So sometimes people will say, oh, I had a blah, blah, blah. And I said, was mesh used? Oh, I don't know. Then I need to write to the surgeon and say, please, I need to know, was mesh used? And if so, then I can't work that scar around it, but I can't work that scar because it can cause enormous problems for people.
Yeah.
We can start working scars. I know when I did the update with Sharon Wheeler, who was out from the States a couple of weeks ago, she was working on an 80-year-old woman who'd had an ovarian cyst removed, and she'd had cesareans, and she'd had all sorts done, and a knee replacement, and Sharon started working on her scars. And I mean, she'd had them done 30, 40 years ago. And she managed to get the body to do some adjusting and to adjust the scars. You're never going to get the scar 100% at that age, but you can stop some of the effects that are happening on the person's body, and you can soften scars. You can make a difference.
So you can get more blood flow into the area.
Yes.
And just comfort.
Yep. You can get rid of
that pulling, yes, and that potential,
yeah,
misalignment through the rest of the body.
You can get some of the adhesions maybe to release. You may not be able to get all of them to release, but you can make changes. And the body is amazing in that once you start on the work, I mean, we just say to the body, here we are, I'm going to do this little, what do you think? And the body says, okay, cool, leave me alone for a couple of weeks and let me now, because I've got a bit more blood flow, I've got a bit more here, and the body takes over, and you will see changes over a couple of weeks. So we basically just the catalyst. We get it started, and then the body takes over and does this amazing stuff.
So you go into that listening state, don't you? You're taking the person and the body into a listening state for the body to then go and do you find that, say you start releasing scar tissue in one area, the body goes, brilliant, that's good. Okay, you're listening. Yes. So there's also this. There's also this thing over in the shoulder, and then suddenly it's the other thing is going out. Good. Yeah. This is my second in command is now wanting attention.
Yeah. And so when we do the scar work, we normally finish off, she always says, about 15 minutes at the end, do some massage in whatever area. So especially women who've had mastectomies, they will have been walking around with their shoulder pulled forward in protection. Okay. Yeah. They don't actually realize they're doing it, but they are. And even if they've let that go a little bit, so it's not quite as bad, all of those neck and shoulder and back muscles are going to be like, oh, help me.
Yeah. Debbie, so please.
We work all of that out. Yeah, we do all of that. And it's amazing work.
So the latest research into pelvic floor dysfunction and specifically prolapse is and it's only come out this year, really. I mean, clinically, pelvic floor physiotherapists have seen this for many years, but really there's only been the actual research into it this past
research
is showing that episiotomies and, like I said, tearing when you've been stitched up and there has been a scar that's been, as you've got scar tissue in the perineum, that pulling of the fascial system is actually behind prolapse, or it might be postural misalignment and therefore tension patterns around the tailbone, etc. and that bunching of the fascia, which is what you were talking about,
Yes.
is actually pulling the organs down into the vaginal canal.
Yes.
So there has been apparently extraordinary results with myofascial release work around
Yes.
scar tissue
Yeah.
and organs drifting back into their anatomical
Yes.
position, and prolapse being significantly
reduced.
improved.
Yeah.
Well, like way more than Kegels, and it's so really interesting, isn't it?
It is. And the thing is also with those scars, because of the pulling on that central portion of the body, you're going to get the hips will have to adjust as well, which will then affect your hips, which will then affect how your knees work, which will then affect how your ankles work.
Yeah.
You have this cascade of effects all the way down. And most of the time, you may not even realize that your knees are now pulling inwards or whatever, because you know you're concentrating more on what's going on up here than down there. And so it's the body is just mind-bogglingly amazing. I'm going goosey again.
So complex and so connected, isn't it?
Yes.
Again, I was talking today all about the feet and how much our feet and not being all clawed together, right? Feet really affect everything up the chain as well. And actually trying to transition us into a state of that reverence and that gratitude for the body. You know, as I said before, the changing the mindset from, and this is wrong, and this is wrong, and this is wrong, and this hurts, and this hurts bad, to, wow, I'm getting these signals, and body, I'm now ready to listen. And thank you for the service that you have given me. And you know, I'm getting tingles now just saying these words, you know, and thank you. So trying to transition us into a mind-body connection. And it is woo-woo, but we're not, the head is not disconnected from the body. It's not disconnected from the pelvic floor, and the feet are not disconnected from the fingers. We're all one big sack of goodness.
Very much so. Jan Trawartha went out to Bosnia. You know, I went out to Bosnia in 2019 to do massage therapy on the war victims.
Yes.
You also went out there, and she's written a book, which I've bought, about biotensegrity. And she had a photo there of a man whose the big toe on his foot had been blown off. And she said, if you have a look at the scar, the other toes have moved more to the center because it is now adjusting. He doesn't have that big toe. So they've kind of moved into the middle to give him more balance. She said, in this case, you don't touch the scar, because if you loosen that scar up, his foot is now going to be unstable.
He can't walk.
So he's not going to thank you for that. So it's having a look at that. But I mean, the body had adapted to him having his foot blown up. It had moved his toes across so that he can walk. I mean, that's
seriously cool, isn't it? And like when you see a three-legged dog, it's the same thing, isn't it? You're like, that dog's learned how to walk. You know, their body has adjusted to get that dog walking. Amazing. So when you see a client, so somebody who's had multiple experience, for example, or keyhole surgery in the abdominal area, what's a typical session like? What do you tend to do?
So what I would normally do is I like to take photos, which are kept very private. There are no names attached. I don't photo any bits that shouldn't be photoed, unless it's with my breast cancer ladies. Don't include faces, but it just gives you an idea of what the scar looked like at the beginning, and then we take one at the end and say, okay, let's have a look, get people to feel their scars. You know, how does it feel to you? You tell me what you feel and how it affects you. And remembering as well that a scar is not just a scar on your skin. It could have been a traumatic event that caused a scar. I know a young girl who lost her leg in a hit and run in June. A lot of people, when it comes to that, or cancer or whatever, there's a trauma involved. So you need to deal with people, mind as well, emotions, trauma. We deal with all of that. have a look at the scar. Some people have never touched their scars. They don't look at them, which has now caused problems in the relationships because they don't want their husband to see them, or they don't want their children to hug them. So we look at all of that, talk to them about it, and then get them to lie down, and then we start feeling. And as I said, from the outside, feel and see where there is tightness. Have a look at the body when, like, from the head down towards the feet, because often you'll see an imbalance in the abdomen or wherever it is. You'll see one side might be higher than the other, or it might be slumped across one side. Have a look at all of that and feel what is going on. You need to feel. Push the scar from different areas, different sides, to see, is it puckering? Are there adhesions here? How red is it? Does it feel stringy if I pull it this way? Are there edges? Is there more on one side than more on the other? Especially with Dieppe scars and that, you'll find that the tissue at the bottom, just above the pubic mound, a lot of tissue there. So you can't scoop it in to meet the scar. You need to work that area as well a lot more. It around, do gentle press and reset, and you'll often find that tissue will sort itself out. Interesting. So a lot of women who've had hysterectomies or whatever, they'll find that fat pad that they have has slid down, and they've got like a fat pad over their pubic bone.
Oh, so is that sort of when it looks a little bit more like a camel toe kind of thing, where like fat cells have kind of dropped down a little bit more?
Yeah, so they've got like a fat, am I allowed to say it, a fat fanny?
Yeah, no, exactly. There is more, yes, and it totally makes sense, doesn't it? If literally those fat deposits have been, pulled
well,
down.
they can't get back up to where they should be because there's the scar in the way.
Yeah. That makes sense, doesn't it?
We have a very gentle technique of actually pulling that, and pulling a really hard word, but it's not. It's very, very gentle.
Coaxing, maybe.
Coaxing, good word. Just gently coaxing it back, so that often you may not get perfect results, but you'll most probably get better results.
Sorry, I just about to say you won't have a skinny fanny, but it's completely inappropriate and not, so please. So that was silly nonsense. But no, so what you mean. So just and of course we need that protection, don't we, as a protection mechanism. So that in itself could make a massive difference to somebody, how they feel about themselves.
Yes, and how they feel, how they look. And we just work that scar, and I'll work the scar for 30-45 minutes. Doing the different techniques, what I feel would be necessary. If you've got a stringy scar, we do a bit more combing. If you've got adhesions, we do a bit more. Burn scars, we tend to do very gentle stuff, because the skin on burn scars is very, very tender, and it can get very irritated very quickly. So burn scars are shorter sessions. And in fact, even with new scars, we've got to watch that top tissue, because it's still very, very delicate. So there's not a lot of, rubbing or anything like that.
No, I get it. Okay.
And keloid scars, you know what keloid scars are? Those are the scars that just keep growing and growing and growing and growing and growing. I mean, they can become enormous.
The scars can become, sorry, can you just explain that a bit more?
Okay, so a keloid scar is normally, you'd recognize it in the fact that where you've got your scar, outside of the scar keeps growing, and you get this rubbery pink, red,
mottled kind of. Is that
not always mottled? It depends on the color. Most of them happen on Latino people and people with black skin. They are prone to them, but that scar can keep growing and grow until you've got masses of them growing on you.
So the actual, so you've got to say the seam of the actual scar, but then the skin around it.
Around it, all grows these like balloons.
Okay.
They like balloons or cushions of scar.
Like bubbles, like bubbles.
And they can be really big. Really
interesting.
Okay. So the thing is with those, they still don't 100% understand why they happen, but they feel that it could be loading. So when you've got your scar, that the tissue around it hasn't been supported and held in towards the scar enough. So you've got that pulling that happens.
Yeah.
I think that's got quite a lot to do with the tension that then somehow causes extra proliferation of scar tissue. And with those, we don't do any direct rubbing on them at all, just very gentle around the edges, and they take a long time to come right. But a lot of work is more on the surrounding tissue to find where is it tight, where is the pulling, can I feel what's going on around it, and working more on that. Because with keloids, you cannot surgically remove them. If you do, they grow back again.
Interesting. Gosh, that's really quite complex. It sounds like there's all sorts of different variants, variations of things, and each person that comes to you sounds very, very unique. So it's a very holistic approach.
So you'll also get hypertrophic scars. A lot of people aren't sure what is the difference between a hypertrophic scar and a keloid scar. Hypertrophics are also raised, very red, very thick feeling, but they're within the line of the scar. They don't spread to the tissue out of that. And they can take also a long time, not as long as keloids, but they can take well over 2 years to settle down.
Would you be working directly on the scar, gently or on the scar?
We would work on the scar with that, but not for long, because that tissue is also still, it's still proliferating and maturing. So we would, but you can work along the sides of the scar, you can work along the surrounding tissue, and even just working on that can change the feel of the scar.
Amazing.
People have itching.
Yes, I remember my cesarean scar was itchy.
Because very, very itchy. And some of them, especially keloids and hypertrophic, it's due to an extra release of histamine through the mast cells. But they found that even if you give people antihistamines, it doesn't stop the itching in the scar. So they're not quite sure what's going on there. Scar work can help sometimes with the itching as well. So it's very, very gentle work, and everybody is different, and you've got to deal with a whole lot of stuff that they come with. I have a lady at the Fountain Center. I volunteer there every Monday afternoon with the cancer patients, and she had a mastectomy. She's had a lot of her lymph nodes removed out of her armpit. She's not going to have a reconstruction, but there are certain areas in that scar under her arm that are really tender. And you've got an idea of where it is, but you just got to work very carefully, because sometimes she'll suddenly jump and go, ow, okay, I've got my finger there, I'll watch that. But then you'll come in it from a different angle and it will also hurt her. So then we never do a no pain, no gain. Never do that. And I don't do that in massage either, because it doesn't work. It is totally counterproductive. So if massage therapy pounds away at you and you're saying that really, really hurts, you say, don't do that to me. Because the body will react by sending messages to the nerves. The nerves will come back to the muscle or wherever and say, tighten up in defense, you're being attacked.
Yeah, absolutely.
Tightening up, your therapist is bashing away at it. We get nowhere. You've got to be sneaky. You've got to be really sneaky how you come into those painful areas. Work them a bit, come away, come in from a different angle, work it differently. So with this work also, no pain, no gain does not work. There is an idea that if you work scars really painfully, you will increase the inflammation stage, which might get the collagen to lay down in a better formation. But I trained with Sharon Wheeler. She said, you don't need to do that. The work can be really gentle. And she said, I mean, she's teaching this around the world. She's been doing it for over 40 years. She said, I have had the most amazing results. Just gentle work, saying to the body here, how can I help you? How can I help you?
Yeah, I'm listening and I want to.
What do you need?
Yeah. And I was just thinking how profound it is that you are a masseuse working alongside your scar release therapy, because it's exactly that, the allowing the body to feel safe and held, literally. And when there is pain or tension around a scar, working then maybe on releasing tension by just being held around the shoulders or feet release, whatever, can allow the whole system, the parasympathetic system, to be enhanced, the whole body to go, now I feel safe. Now I can let go. You know, the pain, the brain, which is where our pain receptors are, can just start to calm that
calm
whole
it down,
down. So it just feels very holistic what you're doing, and that's how we approach yoga too, isn't it? It's just very much about making the body feel safe and using the breath to slowly open up.
Yeah. And also we always start with what is called feather light stroking. So it's just stroking, like gently, 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 like a feather. But you do the whole area, and you can do that for 5 or 10 minutes, because what it's saying to the body and the fascias, you can relax, you can relax. And a lot of people just love that.
Yeah.
People who really traumatized by their scar or their experience, you don't have to do the scar, you just do feather light stroking across the whole area, so that they start to feel, I can trust her and I can start relaxing it. And just that initial relaxation as well, because for a lot of people, they don't know what it's all about. They've been through trauma, or they're miserable or whatever through their scars, and you give them that opportunity to just say, you know, you're okay.
You're okay. And of course, that feather-like touch helps the endorphins be produced, helps the oxytocin, which is our love hormone, our you know, and endorphins can be stronger than morphine as far as being a painkiller. So literally allowing the body to start going into that healing state, and the hormones it needs to heal. So powerful. So
because your body is not going to heal properly if you're full of stress hormones.
Not at all.
It's not going to
fight and flight. We're running away.
And if you're eating stuff that is causing inflammation in your body, you must expect inflammation in your scar, or your endometriosis, or any of that stuff. So it's holistic. It's looking at all of it and making sure that your diet, you're taking time to rest and relax, is really, really important. Really important.
You know, Debbie, it's so, you know, I am finding that literally every single person I'm talking to, all the therapists I'm talking to are essentially, it's the same message. That we are worth taking the time to calm the fuck down, basically. To take a bit of self-care and stop being human doings and spend a bit of time being human beings. And get the help you need in order to get back to that state of simply being.
No, you know what I say to people? When you're lying on your deathbed, okay, you're busy dying, what are you going to say? Gee whiz, I'm so glad that I did all that extra work and I ran myself ragged and I didn't have time to spend on myself and I didn't get my hair done that time. Or are you going to say, gee whiz, I led a good life? Or maybe it wasn't like Albert Einstein, but I've got good relationship with my children. I enjoyed my job. I took time to relax. I'm healthy. What are you going to focus on what you did? And what are your regrets going to be? Because we regret a lot more the things we didn't do than the things that we did.
Wow.
Like your deathbed, the bigger picture is, am I going to be pleased that I ran myself absolutely stupid and I didn't take care of myself? Or are you going to say, I'm glad I did?
Yeah. Oh, Debbie, that's amazing. Listen, on that note, I think that's a wonderful note to wrap up on. And everyone, you can find Debbie's details in the therapy tent. She really is, as I can attest to, she has got magic fingers. She's quite amazing. She can come to you, which is really amazing. So she can come and spend time with you at your home. So Debbie, thank you so very much.
No, it's a pleasure. Thank you for having me. I just want to point out to people as well that I am qualified also as a cancer support massage therapist.
Oh, yeah.
So that's what ties in really nicely with the specialist training that I've done, as well as the ordinary scar work, is the scars after breast cancer. All of that really tied in, because I really want my massage and my therapies to help people who are sick, you know, who are struggling. So I have clients who have Parkinson's, and I did have a client who had a stroke, and the massage makes a huge difference. It really does. So,
amazing.
So
ladies, if you know of anyone, any of your friends,
please.
This might be a lovely gift to give somebody who's especially, like you say, cancer patients who could just use some wonderful TLC. And
I have to tell you, one of the, she was only 31 at the Fountain Center. She cried at the end of her massage. She said to me, it was the first time I've relaxed for months since my diagnosis. She said, and for this hour, I haven't had to think about cancer.
Ah, what
and
a gift.
For me,
that makes me feel very tingly.
Yeah, it was really, makes a difference. So yeah.
It does make a difference. Thank you. Thank you so much. Take care. And
thanks a lot, Linda.
All
Bye.
right. Bye.